finally back to psychopathology. I can't remember what we've done. I think we've done all of phobias. I think we. It's a group effort. It's a partner effort. Okay, I think I've done the DSM-5 stuff and their characteristics. I need to do the behavioural approach to explaining phobias. That's what I'm going to do. The two-process Mauer's. No, it's fine. Okay, Mauer's two-process model. The behavioural approach to explaining phobias. Wait, I'm going to tie my hair up. You'd think I would do all of this stuff before I started the video, but no. See, why is my hair? Why do I have so many flyaways? Hold on. Argan oil. Come do my hair with me. I'm gonna make that the title of this video. Come do the behavioural approach to phobias and my hair with me. Okay. Wait, maybe I should do a get ready with me. The heck? That's such a smart idea. I'm going to do a get ready with me whilst I do my behavioural approach. But even though it's 7 o'clock now, so I shouldn't really be getting ready, but I feel like it'll make it more fun. And the point of these videos is to make revision fun, and it's not working. Revision is no longer fun. So get ready with me. Okay, so argan oil in the hair. Don't do this every day because your hair will fall out. But just when it's looking particularly scruffy, or the flyaways are really bothering you. I mean, watch the flyaways go back up in a second, it's fine. Then I need to get my stuff. Like, hold on. Okay, full on, get ready with me. How did you revise for your A-levels? I did get ready with me whilst I was revising. Okay. The Mauer's Charlotte Tilbury moisturizer. Mauer's two-process model. The behaviourist approach emphasises the role of learning in the acquisition of behaviour. Okay, so this takes into account classical and operant conditioning. So the behaviour is learned through classical conditioning, through the whole stimulus and conditioned response and all of that job. I'm going to read it out, like what the order is. Okay, no, I don't need to because it was Watson and Rayner's Little Albert study, so I feel like it's pretty obvious. So they had a 9-month-old baby, Albert, and we need more. And they conditioned a response in him of fear of rats. Okay, so what they did is, they first of all at the start of the study, they tested that Atwood? Freudian slip. They tested that Albert wasn't afraid of rats, just to make sure he was starting off fresh. And then what they would do is they would present different objects to Albert, one of them being the rat. And whenever they presented the rat, they would ring a bell, a sharp bell sound. So they'd play an uncomfortable, distressing sound whenever they presented the rat to Albert. So the rat began as the unconditioned stimulus, and the sound as the neutral stimulus, which the sound elicited the unconditioned response of fear. Okay, let me just check that bit's right. Okay, the noise is the unconditioned stimulus. Okay, so the rat is the neutral stimulus and the noise is the unconditioned stimulus. Yeah, and then as they gradually kept doing this, the rat and the noise became associated, and then the neutral stimulus, the rat, becomes the conditioned stimulus that, even without the presence of the unconditioned stimulus, the sound elicits the conditioned response of fear. So through association, classical conditioning, you learn to be scared of something. So this can work in real life if somebody goes to the ocean and when they're younger they have an experience of being swept out to the tide. So the experience of nearly drowning, let's say they nearly drowned, the experience of nearly drowning is the neutral stimulus. The ocean is an unconditioned stimulus, which elicits elicits the unconditioned response of fear, and then they become associated together to elicit. So the neutral stimulus for ocean becomes the conditioned stimulus, which elicits a conditioned response of fear. So that's acquisition by classical conditioning. Then maintenance by positive by operant conditioning is all about positive. Why am I not doing my get ready with me? Come on, G, like come on. This is all about maintenance by operant conditioning. So this is about positive and negative reinforcement and also punishment, but mainly positive and negative reinforcement. So let's first of all just establish what they are. Positive reinforcement is when you negative reinforcement is the removal of the negative. So in attachment we talk about the baby crying, and so the positive reinforcement with the fear, let's continue the idea of the ocean, is avoidance behaviour. It's about avoidance behaviour. So you avoid the ocean. So the positive reinforcement is you do not feel the distress the ocean would have given you otherwise. And the negative reinforcement is the removal of the distress and the fear you would have otherwise had. So it's just about reinforcement. It's about avoidance behaviour, and when you avoid the phobic stimulus, the fear is perpetuated. So this is why evaluation in psychological interventions and therapy, we encourage the person with the phobia to partake in endurance behaviour and to expose themselves to the phobic stimulus, because avoidance behaviour continues. I have to do so many more videos tonight. Am I just going to keep washing my face and redoing the get ready with me? So that's Mauer's two-process model: acquisition by classical conditioning, maintenance by operant conditioning. Let's just check I got all of that. Yes. The reduction in fear reinforces the avoidance behaviour, and so the phobia is maintained. That's what I said. So that's the two-process model. I actually decided, do I want to do a get ready with me at 7:17? Like, my skin's just going to break out for no reason. No. I'm going to do a semi-get ready with me. I did the evaluation, but I have no idea where it went. So maybe it's already in the video and, like, the clips got mixed up, because I'm not tech savvy, but I'm going to quickly do it again. Real-world application can be used in flooding and systematic desensitization therapies to prevent avoidance behaviour, because we know avoidance behaviour contributes to why phobias are maintained because of operant conditioning. Cognitive aspects of phobias are ignored. So the behaviourist approach only focuses on the actual behaviour. It ignores the cognitions and the emotional aspects that accompany it. So this is a very limited approach, and also it's very limited in real-world application, because even though it offers flooding and systematic desensitization, this focuses on preventing avoidance. This behaviourist approach cannot be used in therapy to help people with phobias to emotionally and cognitively cope with what they're thinking and feeling and their experiences. Not all phobias are related to traumatic experiences. For example, my phobia of small spaces has no traumatic background. De Jonge found that 76% of people who had a fear of dental treatment, a phobia of dental treatment, had also a traumatic experience, compared to a control group of people with a low fear of dental treatment. 26% had a traumatic experience. So traumatic experience does not always correlate to having a phobia. So obviously that is very limited explanation. Learning and evolution. So did I say this? Well, I have said it before, but it's evolution. It could be evolutionary. So my fear of small spaces is probably evolutionary. So it's quite a limited explanation. I think that's everything. Yes. Now we're going to move on to the behavioural approach to treating phobias. Yes. I'll do that in this video as well. Hold on. Systematic desensitization is... Do I need to know the psychologist who came up with them? No. Systematic desensitization is this. Let's just establish flooding is a much harsher and quicker treatment. Systematic desensitization is much more gentle and kinder treatment, and it takes place over a long period of time. Okay, I think a flooding session is £100, whereas systematic desensitization, I think per session it's like £80. I don't think it says that in the book. I think I just looked that up at some point. So an actual individual session of systematic desensitization is cheaper than a flooding session. However, this is counteracted by the fact flooding can be done in as little as one session, whereas systematic desensitization can take, I think the average is 8 sessions, or it could take up to as many sessions as is needed. So systematic desensitization requires the patient and the therapist, psychiatrist, coming up together with a pyramid, a hierarchy of fear, yes, the anxiety hierarchy. So basically you're saying at the bottom, I think it's divided into 10. It's divided into 10, but it doesn't have to be divided into 10, but that's the example in the book. So at the bottom is things that do not give you that much fear. So my fear, no, let's not do my fear. Let's do a fear of dogs. Wait, is that the one in the book? Okay, I won't do that because that's the one in the book. Let's do a fear of darkness, a fear for dark. Okay. So at the bottom of the anxiety hierarchy, you might say being in a semi-dark. Would that be at the bottom? Okay, I think at the bottom of the anxiety hierarchy could be something like watching a film that is set in mostly darkness. Or it could be like being in a semi-dark room where the light is like you only have like one lamp. Whereas at the top of the hierarchy would be your actual self being in a dark room for a longer period of time. And then you build yourself up the hierarchy. So each session you look at one position on the hierarchy. And what's really good about this therapy is that it does it in a gradual way, and the therapist needs to work with the patient to psychologically comprehend and to be able to process and feel comfortable in what they're doing, and they are leading it. So when they're ready to move on, they feel they have coped and gone past that stage, and they can be in that stage without any anxiety or fear. Then now you move on to the next stage. So it's not rushed. It takes as long as it's needed. Okay, and then it's said to have worked when you can be in the final stage without feeling fear or anxiety, or phobia is cured, or cured. Okay, so then we're going to move on to flooding. Flooding is a much more vigorous treatment because it happens, and it could be as little as one session. And this is where your phobic stimulus, so fear of the dark, is presented to you immediately with no gradual build-up. So if you're scared of the dark and this is your phobia, you would immediately be placed in a dark room with no light it would probably have to be for like, I don't know, at least an hour for it to do anything. So, and alone, let's say, because being in a dark room alone would probably be scarier. So flooding is much more vigorous and happens over a much shorter time. Let me just check there's no research. Okay, so that's all of the AO1. Oh no, I just need to remember systematic desensitization, anxiety hierarchy, relaxation. So I said that it's like the processes of gradual build-up and you feel comfortable, and the therapist offers relaxation techniques. Exposure, you're exposed to the phobic stimulus. Flooding, this process is called extinction, and it's said to be extinct when a conditioned stimulus is encountered without the unconditioned stimulus. And this no longer produces the conditioned response of fear. Okay, and then ethical safeguards. Even though you give fully informed consent to be able to take part in therapy, there's still ethical safeguards because one ethical safeguard is that you're not being placed in harm you wouldn't normally be in, and you could argue, well, you are. Okay, so and it can be very distressing. So that's order A1. Evaluation is both have real world. Okay, evaluation really quickly. Evidence of effectiveness. Lisa Gilroy followed 42 people who had SD for spider phobia in 3 45-minute sessions at both 3 and 33 months. Afterwards, the experimental group SD group were less fearful than a control group. Okay, people with learning disabilities. Systematic desensitization, cognitive therapies do not work very well with people with learning disabilities or people with dyslexia or people who struggle to talk about how they feel, or young children, because that involves thinking processes and understanding your cognitions and knowing how to audibly word what you feel and how you want to express it. Okay, yeah. SD in virtual reality. So, however, the SD can be conducted using virtual reality. I think wouldn't virtual reality apply to both of them though? But it's useful in systematic desensitization, I guess, because it's a much longer process. But using virtual reality can save money, and some situations practically wouldn't be possible. I don't know what, like crocodiles, if you live in the UK. And then to go off from that, one criticism of these two therapies is that sometimes they're not going to be practical. You know, if you have a fear of sharks and you're living in Cirencester, that's not going to be very good. Like, how are you going to get near these sharks? Yeah. So there's that, and they're both costly, particularly systematic desensitization is costly in the long run because there's so many sessions. So it's costly for the NHS. I think it's the NHS who does it. Must be. Costly for the NHS, costly for the patients, because they have to pay a lot of, not if they're getting it on the NHS, they don't. Hold on, let me read. Okay, so it doesn't say in the book, but it's costly for the NHS, basically. But however, to counter this, even though it does have bad economic implications for the National Health Service, it's still getting people back into work if it's successful, so in the long run it's beneficial. And to counter that, flooding could be better than systematic desensitization because it's much cheaper, because it could be done in as little as one session. So that's a lot less time consuming as well. Okay, that's another criticism of systematic desensitization, is that it's time consuming. So not many patients are they have to take time out of work, so economic implications, and a lot of people are not going to be committed enough to dedicate all the time to these sessions. Okay, traumatic. Okay, one limitation of flooding is that it can be quite distressing and traumatic because it's so vigorous and abrupt, so it might not always work very well. Okay, that's the behavioural approach. Okay, now we move on to the cognitive approach. What have we... No, we're not doing it by approach, we're doing it by... So now we move on to explaining depression and treatments of anxious use. Cognitive approach. Okay, now we move on to depression.